We're talking with Dr. Charles Martin about ways folks can bite right into a big old tasty candied apple, and I'm hoping there's no chainsaws or whips involved, right?
Or cow milking.
No cow milking, none of that.
That's right.
Welcome. Let's talk
Thanks.
about dental implants and who's a candidate for that.
Well, dental implants are artificial tooth root replacement. So a candidate for implants are going to be someone who's got dentures that aren't working, which is most people. People have multiple missing teeth. People have chronic gum problems, who have to lose teeth. People with badly decayed teeth. Basically, anyone who's missing teeth or about to.
Well, if people have already had dentures for
Right.
a while, could they switch over to implants?
Yes.
It would be a big improvement, wouldn't it?
Yeah, it's a big improvement. Most people who've been worn dentures for any amount of time lose about 85% of their chewing ability. And implants put back chewing ability very much like teeth are.
And why do they lose chewing ability if they're wearing
Because
dentures?
dentures over time cause bone to resorb, melt away. And when that bone melts away, the face wrinkles, the face collapses. And you can see people, they premature age. They don't look as good as they could or should. So what implants do is give an ability by giving something firm to chew against and stop the bone loss.
It's literally putting another tooth in as opposed to having something that's not really natural rubbing up against the gum.
And then, of course, implants are fixed in place so they don't have to take anything in and out of their mouth.
Okay, so that's obviously a big advantage.
Obviously a big advantage.
Okay,
Yeah.
and you mentioned that people premature age with dentures, false teeth.
Right. Well, the problem is that as you put pressure on bone, it causes it to melt away, and that's what removable teeth does. It puts pressure on the bone. That's where it gets its
So
support.
in the old black and white movies where Grandma took the teeth out and their face was all caved in and everything, that's from wearing those false teeth like that.
That's wearing those false teeth like that.
Okay,
That's exactly.
and you don't have that problem with implants at
No,
all.
it cures that problem.
Okay. All right. You always bring these before and after pictures with you.
Yep.
And so we want to take a look at that now. And this is a pretty dramatic difference here.
Yes.
What's going on here?
This gentleman, we asked him to smile in that first picture. Of course, he's not smiling as much as he could or we'd like him to. But you can see that it's not a smile he's very proud of.
Right.
And he's kind of hiding what we call a semi-smile. Now, of course, he's got a very big one. And now he is very proud to smile. And the thing is that he looks happier, and the people around him are happier because of it.
Yeah. And these are implants.
Yep, they're implants here.
Wow, that's an amazing difference. And obviously, when people, what happens to a guy like this gentleman we're taking a look at here? What happens to him in his life? I can just guess that he's got a whole different outlook on life.
Well, it's transformational dentistry. Once you change someone physically this way, all the other dimensions of life and living change. The intellectual, emotional, spiritual, mental, all those change because you help someone to look their best.
Yeah.
And they feel better about themselves, and so do the people around them.
Well, it's obviously, I mean, that was a big difference. So they feel better about themselves, about the way they look, and the people around them. Obviously, you got a beautiful new smile.
Absolutely.
And so it's got to change your attitude, and you feel better because you're able to eat better, the whole thing.
Right.
Very
Exactly.
good.
Yeah.
Big difference. Thank
Big
you,
difference.
sir.